Okay, and our last speaker is Henry Poultney, who's LGBT development worker for the Wirral LGBT Network, and I think he's come to talk to us today about the work of that network. Okay, so over to Henry.
Okay. Hi, hello. I'm Henry Poultney. I'm from the Wirral LGBT Network. Managed and using shared office space with Terence Higgins Trust, based over in the Wirral. THT is a leading UK sexual health promotion and HIV prevention charity. The network itself is to provide information, advice, support and advocacy for all LGBT people across the Wirral. And today I want to kind of give you an update about where we are up to and how the network is addressing within the community homophobia, transphobia, and utilising the research that was done through Liverpool John Moores University and also the Joint Strategic Needs Assessment from the National Health Service. Terence Higgins Trust has a locally well-established base within the Wirral, and it's a quite well-respected resource within the LGBT community. It's engaged with and supported the LGBT community for a significant period of time and offers several sexual health promotion and HIV prevention initiatives, such as the HIV fast testing clinic, where someone can be made aware of their HIV status within 20 minutes. Now that can really address the kind of barriers in regards to someone accessing a HIV test and being able to do so in a community environment that they feel safer to do. Also provided a kind of chlamydia and gonorrhea testing, and we have Men Who Have Sex with Men outreach services based across the Wirral in saunas and sites where unknown Men Who Have Sex with Men activity occurs. We're well linked with the kind of local GUM services, so THT managing our network is nothing but a benefit, really. So moving on to the kind of Joint Strategic Needs Assessment, it was published in 2012 and was a comprehensive analysis of the needs of LGBT people, so lesbian, gay, bisexual and trans identified people within the Wirral. It's supported in the bid for the Wirral LGBT Network from the Big Lottery Fund, and the piece of research itself I'd definitely encourage you all to read. It's available online, and it's a comprehensive and extensive piece of research directly with the community, and it's extremely participatory, and it's been extremely useful in regards to developing the network and looking at setting our kind of key priorities moving forward. So the NHS funded a kind of 6-month time limited project for the JSNA, but it got then to the point where once that funding had stopped and finished, it was a need and necessary for Terence Higgins Trust to support with a big lottery funding award bid. Now, the bid itself is in regards to developing 10 LGBT identified individuals in the Wirral to engage them with a volunteering programme, which will include facilitating social and support groups, mystery shopping services around inclusivity, looking at the issues that we've had presented very eloquently to us today in regards to heteronormativity, presumed heterosexuality, erasure of transgender identities. So looking at about that, and also in regards to encouraging volunteers to come forward, providing volunteers with a comprehensive induction and ongoing support programme that works well with our partnership with Terence Higgins Trust. The Wirral LGBT Network essentially wishes to provide training to public, private and voluntary organisations and agencies to promote better LGBT awareness and inclusivity in the Wirral. We're utilising an asset-based community development approach to best serve lesbian, gay, bisexual and trans people within the Wirral. And basically what we really do aim for to increase is improved life chances, creation of positive support opportunities, reduction of isolation, reduction of homo and transphobia within the Wirral, and better experiences and access for every LGBT identified person living or working within the Wirral Peninsula. Okay. So in terms of reaching out to the community that we wish to identify within the Wirral, as I mentioned, THT, Terence Higgins Trust, has a very well established relationship on the Wirral in regards to the community. The creation of an online presence for the network is encouraged it to blossom really. Within the last 3 months, we've had over 100 new likes on our Facebook page, which is a definitive indicator in regards to the network having an increased presence. Utilising social media such as Twitter and Facebook are providing a useful and fresh way to access an LGBT audience throughout the Wirral. But not only that, we're aware not to cause a digital divide within the community, so all events and services are also being advertised through alternative means, including through the Wirral libraries, which I'll go on to mention further. So looking at social media and Twitter surgeries, looking at how we could use web seminars and Facebook, we want it to be innovative but also be able to access the community who would not perhaps access our services otherwise, other than the internet, and how we can provide ongoing support to those individuals. We have well-established peer-led support groups, such as the weekly LGBT drop-in, and that attracts a wide cross-section of the community. Its intention is to promote positive well-being, support around sexuality and gender identity, but primarily focusing on health promotion and sexual well health, alongside HIV awareness. So within the attendees to the support and social groups, we've developed volunteers. Within the community, we are going to hold community network meetings to identify key partners within the Wirral to provide this kind of bird's eye approach to equality and diversity. And I'll discuss a little bit further some partnerships that we've made with public and private sector organisations already. Looking at how we can best join with community events and venues to embed LGBT equality extremely widely across the spectrum. Whilst we are an LGBT organisation, we wish for every organisation within the Wirral to be LGBT inclusive, and it not just to be a tokenistic kind of addition in regards to their equality monitoring or in regards to their equality duty under the Equality Act 2010. We believe that there's clear work to be done around intersectionality, so in regards to somebody also being LGBT, but they may also be BME, so black or minority ethnic, or they might be an older person, they might be disabled, or they may hold a non-binary gender identity. And often these individuals are erased, and that's true nationally, not only within the Wirral. But how we want to kind of play it is that we wish to be innovative in the way that we reach out to actually garner a very reflexive community approach, I suppose. So in regards to responding to community need, the provision of training and support services to better meet the needs of the LGBT community within the Wirral has been key. The network was invited to attend the Cheshire and Wirral Partnerships Mental Health Trust Equality event as a panel review member to vote in how the trust is performing in relation to its duties as stipulated under the Equality Act 2010. The two-day event proved to be a positive forum to promote the network, making links with the child and adolescent mental health services, drug and alcohol action teams, and more specialised NHS services. But it was an opportunity to advocate on behalf of the LGBT community, informing professionals of additional health needs, obstacles and barriers for LGBT people when accessing healthcare services, and also as well to highlight the importance of utilising the Joint Strategic Needs Assessment within the community, within organisations. In terms of encouraging a proactive and not just reactive approach for organisations to review their policies and practices around inclusivity, we aim to offer and deliver training within organisations, and that's become a key role already within the network. Responding to reactive training needs is fundamental, but we're also endeavouring to encourage proactive equality and diversity training around the Wirral. And several organisations have approached us. As part of our bid, we have to deliver 4 sessions of training to separate organisations. We've already undertaken that within the past 3 months. So you can see that there's clearly a need that we can hopefully capture and move forward further in regards to the Wirral, in regards to education and information. And often that law, policy and procedure can mean a very different thing in practice. So looking around how we can facilitate workshops with health promotion as a central core, smoke cessation, drug and alcohol use and healthy eating across the Wirral, key areas found within the Joint Strategic Needs Assessment and key areas in which the network hopes to assist in providing services to develop within LGBT people. Okay, we with Wirral Library Service, we have developed satellite drop-in sessions. So reaching out to the wider LGBT community, the network's been welcomed to run satellite information, advice and support sessions across the 4 main libraries within the Wirral, which are Birkenhead Central, Wallasey Central, Bebington and West Kirby. And I've chosen those ones specifically to kind of best cover the widest geographical area within the Wirral. They've received some extremely positive pieces of feedback, and we've identified members for the network whom else would never have probably accessed our services. So looking at how we can utilise the research, but then also innovatively go into the communities to embed LGBT equality and diversity, I think is become a key consideration for us as a network. Utilising as well national events that we can also support. We were the only organisation across the Wirral to support within the Time to Change Let's End Mental Health Discrimination Day on February the 6th, where we held a kind of drop-in advice, information and support session, but it was in regards to encourage people to talk about their mental health and support the work of Time to Change, and utilising the network as a kind of partner agency for national organisations. We're finding that we're gaining very positive results from both the community and also nationally as well. Okay. So there's clearly a need for innovative and integrated working. We wish to develop effective partnerships across the public, private and voluntary sectors, particularly focusing within education, healthcare, policing and housing. I've discussed the Cheshire and Wirral Partnership Equalities Panel membership. We've also been encouraged to take part within an anti-bullying strategy group membership, the NHS Healthy Schools and Young Person Friendly LGBT Advisory Committees, where young people within schools are part of pupil panels who assess the suitability of services that are being delivered to them within the schools. So that may be from youth workers, that may be within sexual health services, and how best to improve the services to make them inclusive for not only all young people, but most specifically LGBT young people. We're part of the Multi-Agency Risk Assessment Conference. Now, hate crime is vastly underreported both nationally and locally, and this trend reflects on the Wirral. Hate crime disproportionately affects the LGBT communities and leads to lesser life chances and lowered self-esteem in victims. To encourage the reporting of hate crime within the LGBT community and accessing reporting, the Wirral LGBT Network wishes to be part of all ongoing initiatives in regards to how to best encourage the community to report. And alongside this, the network's part of the MARAC now, the Multi-Agency Risk Assessment Conference, and can now directly offer support, information and guidance to individuals who've been the victims of hate crime because of perceived links to gender and sexual orientation. The network's a participatory agency now, available to record events onto the MARAC database, so we're hoping that this will then reduce some stigma about reporting within the community, and we can directly undertake some training with individuals to better report and make the Wirral a more accurate picture of reporting in regards to hate crime and those individuals who've experienced it. Moving forward, the project is only funded until March 2015. We wish to provide ongoing evidence to the Joint Strategic Needs Assessment for it to become a working document with the projects that we're running, projects that we intend to run. So we have the social and support groups. We have links with other agencies and other LGBT organisations across Merseyside, and not only the Wirral. And more so specifically as well in regards to further research and project opportunities. What's become extremely poignant in regards to, say for example, equality monitoring, is that the wording and labelling used within research documents is extremely poignant and important. The network's continuing to kind of collect equality monitoring statistics of all use of its services, and utilising funding metrics, so metrics issued by funders in regards to gender identity and sexual orientation, can be sometimes problematic because it doesn't reflect the communities in which we directly serve. So for example, we as the network wanted to ensure that our data collection is congruent with what's required by funders, but also as well we were aware that the categories given to us of sex, which were male and female, were not then transferring within self-identities of individuals who are part of the network. who may identify as a man or a woman, or a multitude and plethora of gender identities within that binary. So on asking a question around capturing data around gender identity, the binary sex options of male and female, as recommended by our funder, didn't reflect the group that we served. However, on approaching the funder itself, they responded extremely positively to us being able to record someone's gender identity with an open-ended question. So, for example, how do you describe your gender, as opposed to 2-option tick boxes. Clearly, in regards to as well, that can also translate with sexuality, and we're extremely kind of aware in terms of utilising further research and project opportunities. We'd encourage any researchers who would wish to be part of the network or would utilise our membership to undertake research. We'd only encourage you to kind of get in touch with us. One thing that we have noticed in regards to project opportunities is a vast underrepresentation of those who describe themselves as black or minority ethnic or BME, or those who belong to service user groups of older LGBT identified people. And this presents us with new elements to the network and how we wish to move that forward, and working both with both multicultural organisations and the Age UK organisation itself. We aim to address this imbalance and looking forward in the next 3 months to develop some initiatives that will hopefully target those communities specifically to both encourage involvement and also embed equality within the Wirral organisations themselves. So that's that. That's the Wirral LGBT Network.